My name is Vilembwa, Olivia. I'm a clinical nutritionist based at the Aga Khan Hospital, Kisumu. Today we will be covering on feeding the preterm babies. Preterm infants have higher nutritional needs than their counterparts who are born at term. The nutrition requirements for preterm babies vary according to the weight and gestation of age that these babies have been born. So the energy requirements will vary from 110 to 20 kilocalories per kg per day. The proteins will be 3 to 3.8 grams per kg per day. The fats are always at 4.5 to 6.8 grams per day. Other nutrients are calcium and phosphorus that are put into place. That calcium is 120 to 230 grams per kg per day. That is basically for bone development. And phosphorus is 60 to 140 milligrams per kg per day. The best feed to give a preterm baby is always the mother's milk. In setups that are well set, then the second choice could be human donor milk, which in Kenya is rarely practiced. And the third choice would be a preterm formula. Human milk is the best, especially mother's freshly expressed milk. For optimal growth, when the baby is not gaining weight, then fortification of human milk is advised. And feeding is advised cautiously, especially for the very low birth weight preterms, until we get into the optimal weight that a baby needs to be discharged from the incubators. Most infants that are born preterm have not developed the suckling effect. So most of them are fed via NG, that is enteral feeding. And when enteral feeding is not viable, then the preterms are put on parenteral feeding. And the parenteral feeding is always weaned off when enteral feeding is viable for feeding. So most of the food that we give preterms is mother's milk, which is full of nutrients, antibodies for these babies, and because of their physiological and metabolic stressing factors, then the best is mother's milk.